Hi guys, and welcome back to another Wellness Wednesday video. Today we are talking about rheumatoid arthritis. Does cold plunging help it or hurt it? Let's find out. As always, guys, I'd like to give a huge shout out and thank you to my research team for putting this all together. The studies we comment will be linked in the description below. And if you have not already, please do like, subscribe, and hit that bell icon so you get notified when we post new Wellness Wednesday videos. So first and foremost, what is rheumatoid arthritis? Rheumatoid arthritis is a chronic autoimmune disease which causes inflammation of the joints and surrounding tissues. It occurs when the body's immune system attacks its own healthy cells and tissues, which can lead to pain, swelling, stiffness, and loss of function in the joints. So you already know from other studies that we've talked about that contrast therapy can be super beneficial. Contrast therapy is helpful for rheumatoid arthritis in a couple of ways. Heat therapy can help increase the blood flow by making blood vessels dilate to pull in more oxygen and nutrients, which can relieve stiffness in joints. And cold therapy causes the blood vessels to constrict. This reduces blood flow to the area, which can help to relieve swelling. This is why cold packs are often applied to affected joints to relieve swelling during a rheumatoid arthritis flare-up. So the overall results from this study, which came from the National Rheumatoid Arthritis Society, was that we need more studies. Go figure, we're finding that as a common theme. Much of the evidence at this point is anecdotal. There seems to be a lack of study data to back up that contrast therapy is, in fact, what is helping a number of people. However, the number of people who want to stick with this kind of therapy after trying it is compelling enough to make them believe that there is a lot of benefit to this kind of therapy. The second study we looked at came from OrthoBracing. One of the things that they were talking about is the fact that cold therapy is not equal. Not all cold therapies are the same. Cold therapy for arthritis is a safe, well-tolerated, and effective treatment for arthritis pain and swelling, particularly in the joints. Applying ice to a swollen, stiff, or painful joint reduces blood flow to the area and can have a numbing sensation that reduces the pain associated with arthritis. This goes back to what we already know about cold therapy and pain management. A 2019 study using rats found that applying cold therapy to a specific area of the body improved rheumatoid arthritis symptoms like inflammation and swelling. While it's not definite whether these benefits transfer to humans, the study suggests a lot of promise for cryotherapy for arthritis as a way to manage discomfort at home. Now, they go on to talk about the different types of cold therapy, such as ice pack, ice massage, ice baths, cold showers, and prescribed cold therapy machines. They went on to talk about the pros and cons of both cold and hot therapy. So cryotherapy for arthritis works better for acute pain and swelling due to its numbing effect. Heat therapy for arthritis can provide more relief if your muscles are tired or achy. So this supports not only cold therapy, but contrast therapy for arthritis as well. The last study we looked at came from the National Library of Medicine. What they were specifically looking at was combining an exercise program with cold water immersion recovery in patients with rheumatoid arthritis. One of the things the study found was that people with rheumatoid arthritis, because they are in so much pain, often do not exercise or move as much as other people, which makes total sense. So this study was looking at combining a overall low impact exercise program with water immersion afterwards. Now, in this case, they did the cold water immersion immediately following any kind of workout. The reason they chose cold water immersion for the cryotherapy part of this study was that it is significantly lower cost than any other cryotherapy treatment option. No participant showed any significant decrease in pain. However, all of them showed a decrease in joint swelling after the first phase. So in conclusion, can cold therapy help autoimmune disease? All studies seem to be pointing toward yes. Rheumatoid arthritis can be super debilitating for people, so it's really exciting to see that there are some benefits coming out of the cold therapy. Now, again, we don't really know if it is going at a deeper level than just the pain management and the swelling management, or if it is actually helping cure whatever is causing it. There's just not enough data to prove otherwise. There are claims, of course, made on both sides, but until we see concrete evidence and greater amounts of studies coming out, being third-party peer-reviewed, we're probably not going to have any exact answers. But for the time being, it appears if you have rheumatoid arthritis, doing contrast therapy or just straight cold therapy can absolutely be beneficial from a pain management perspective.